I'm Dr. Stephanie Brode, and we are back with another episode of the Addiction Education Series presented by the Cardinal Crew. Today, we are going to talk about esophageal varices. So what exactly are esophageal varices? Well, if you refer back to the video on portal hypertension, it will show and explain exactly what the portal vein is and where pressure can develop in that system. But in short, basically, when there's too much pressure in the portal vein, which is a large vein that runs through the liver, the body can make what we call collaterals, which are extra blood vessels that try to bypass the liver so it doesn't have to go through the highly pressurized system. Sometimes these collateral veins can be established at the lower end of the esophagus, and they become dilated and fragile, which leads to the formation of these esophageal varices. A lot of times, people don't necessarily know if they have esophageal varices, but if they rupture, you will definitely know. And those symptoms would include vomiting blood, dark or black bowel movements, a bloody bowel movement or diarrhea. And just so you know, if somebody who has esophageal varices has a bloody bowel movement that is bright red, that would be indicative of a very brisk bleed, meaning they need to seek care ASAP. So does anybody experiencing these symptoms, really. And if we do lose a lot of blood, specifically from these esophageal varices, some people might feel lightheaded or even pass out. So there are a couple different causes for portal hypertension and therefore esophageal varices, but essentially esophageal varices are the result of portal hypertension, and portal hypertension develops primarily, the main reason is liver cirrhosis, where there is scar tissue formed in the liver, and that produces the pressure on that portal vein, and a lot of times that is seen in patients with alcoholism. Other less common causes of esophageal varices can be various thrombotic disorders, schistomiasis, biliary atresia, heart failure, and a few other things can lead to portal hypertension that can develop these esophageal varices. Esophageal varices are very prone to bleeding, and because of that, it can be life-threatening. As the varices increase in size and enlarge, their walls become thinner and more fragile. And bleeding from this esophageal varice, like I mentioned previously, is a medical emergency. It requires immediate attention because you could potentially die from severe blood loss. So seeking care immediately is key. For someone who is not actively bleeding from an esophageal varice, you typically are diagnosed on an endoscopic procedure or an EGD, where they actually put a camera down your throat and your esophagus so they can actually visualize these varices. This will determine their size and their potential for bleeding. Some other scans like CT scans, ultrasound, or MRI can be used to evaluate the liver and the portal vein to determine that portal hypertension like previously mentioned.